Hello students, welcome to a discussion of NEET PG 2023 recall of biochemistry. The paper was average and it is mainly based on applied aspect or clinical aspect of the subject, and it is integrated. The questions was from the integration of different subjects, specifically with pediatric, with community medicine, with psychiatry. So integration and the clinical aspects that gives the trailer of next exam. Okay, there are a lot of comments from the students, and they say that the examiner or paper setter was in the drunken state and he is taking the vitamin pills, multivitamin pills, and setting the question paper. And there are a lot of comments on that comment too. So we'll not discuss that. So let's start the biochemistry recall 2023 NEET PG. So the first question: a 5-year-old child, a 5-year-old child, wait, highlighter. So brought to the pediatric OPD with history of diarrhea. Diarrhea, skin rashes means dermatitis and dementia. So classical 3Ds. It is a feature of classical 3Ds. It is a feature of niacin deficiency pellagra. It is a feature of pellagra. Pellagra. Diarrhea, dementia, and dermatitis, and if not treated, death. So it is a niacin deficiency. This is a top rated question. So that's why PYQs are very, very important while preparing for the NEET exam, NEET PG exam. Vitamin C causes the scurvy. Vitamin B6 deficiency causes the neurological manifestations. Specifically when it is on the INH, that is isoniazid, anti-tubercular drug. Vitamin B12 deficiency causes megaloblastic anemia, subacute combined degeneration of spinal cord. Okay, also causes, if intrinsic factor is deficient, it causes pernicious anemia, and there is methylmalonic acid excretion in the urine. This is a case of pellagra niacin deficiency. The coenzyme forms are NAD, NADP, NADPH. NAD, NADP, NADPH. Now, what are the causes of pellagra? One is the dietary deficiency causes. It includes, the first is the diet, deficiency in the diet. Dietary deficiency, or taking the jowar and maize as a staple diet. Jowar and maize as a staple diet. In jowar, there is high leucine. These topics are very, very important because it is connected with nutrition, it is connected with community medicine. So, high leucine content will inhibit the enzyme QPRTase, quinolinate phosphoribosyl transferase, which is involved in tryptophan to NAD conversion. So this is very, very important. High leucine content of jowar inhibit the QPRTase enzyme. So tryptophan to NAD conversion is inhibited. Maize, the niacin which is present in maize, it is in the bound form. So it is unavailable for absorption. So eating this as a staple diet will causes the niacin deficiency. What are the other causes? That mainly includes the B6, that is B6 deficiency. B6 deficiency, pyridoxal phosphate deficiency, it is related with the kynureninase, which is important for conversion of 3-hydroxykynurenine. This reaction, 3-hydroxykynurenine, it is converted into 3-hydroxyanthanylate. And this is the intermediate step from tryptophan to NAD conversion. It is from the tryptophan to NAD conversion. So kynureninase. So there is defect in the B6. This will block this step, and there is If there is blockade in this step, it will causes the conversion of xanthurinate, kynurenine into xanthurinate, and xanthurinate excretion in the urine in the B6 deficiency. So vitamin B6 deficiency causes the niacin or pellagra-like symptoms. This is the second. Third, Hartnupp's disease. Hartnupp's disease, there is defective absorption of niacin, defective absorption of tryptophan from the intestine and renal tubule, and the carcinoid syndrome. Carcinoid syndrome, it is argentaphin cell tumor. The tryptophan is diverted for serotonin production. So less tryptophan is available for NAD formation. So these are the causes of pellagra. So these are very, very important, and niacin is the top rated topic, and second most top rated topic is the Gaucher's disease. Okay. Now see, second question, a 7-year-old child brought to the OPD. A 7-year-old child brought to OPD with history of again dermatitis, thin hair and alopecia. Dermatitis, thin hair and alopecia. Dietary history revealed that kid was consuming raw eggs for a long time. Which of the following will be deficient in the patient? So eating the raw egg means egg white. Eating the raw egg means egg white. It has avidin, and avidin bonds with the biotin. So it forms avidin biotin complex and makes the biotin unavailable for the absorption. So it causes the deficiency of biotin. Vitamin A deficiency causes skin manifestation. Which skin manifestation is the vitamin A deficiency symptom? It is rhinoderma. Rhinoderma, that is toad-like skin, particularly on the extensor aspect of the forearm. Then biotin deficiency causes these symptoms: dermatitis, thin hair, alopecia and mild hemolysis. Okay, then vitamin B6 deficiency causes neurological manifestations. And vitamin C deficiency causes the scurvy, that is gum bleeding, spongy gums, loose teeth and the petechial hemorrhages on the skin. It causes scurvy. Here the answer is biotin. So thin hair and alopecia and the dermatitis. Biotin. Biotin is particularly required for the carboxylation reaction. Biotin is required for the carboxylation reaction. The important carboxylation reactions are: one is the pyruvate carboxylase. Second one is the acetyl coenzyme A carboxylase, and third important reaction is propionyl coenzyme A carboxylase. These are the three important reactions catalyzed by the biotin. And for the carboxylation reaction, what is required? It is A, B, C, ATP, biotin and carboxylate CO2. ATP, biotin, CO2, they are required for the carboxylation reaction. This reaction is particularly important in conversion of pyruvate to oxaloacetate. It is gluconeogenic reaction. Acetyl-CoA carboxylase, it is conversion of acetyl coenzyme A to malonyl coenzyme A. It is first step of fatty acid synthesis, the rate limiting step in the fatty acid synthesis. Propionyl coenzyme A, it is required for the conversion of propionyl coenzyme A to methylmalonyl coenzyme A. This is particularly important for the synthesis of glucose from odd chain fatty acid, that is propionyl coenzyme A. So these are the important reactions catalyzed by the carboxylase, which is biotin dependent. Now there are some reactions which are biotin independent. So biotin independent reactions. It includes the first, the CPS1, that is carbamyl phosphate synthetase 1 of urea cycle, and CPS2 of pyrimidine synthesis, carbamyl phosphate synthetase 2 of pyrimidine synthesis. Third one is the AIR, amino imidazole ribosyl 5 phosphate carboxylase. This is important reaction of the purine nucleotide synthesis. and fourth one is the gamma carboxylation, which is vitamin D dependent. Gamma carboxylation, post translational modification of clotting factor 2, 7, 9 and 10, gamma carboxylation. So these reactions are important, and this is important topic, biotin. Then third, black urine in infancy. It is again again PYQ, previous year question. Black in urine in infancy is diagnostic for which disorder? It is, answer is alkaptonuria. Answer is alkaptonuria. In alkaptonuria, there is defect in which homogentisate is converted into 4-methyl acetoacetate, and the defect is homogentisate oxidase. Homogentisate oxidase. The another name of enzyme is homogentisate dioxygenase, or also known as para-hydroxyphenyl acetate dioxygenase. So homogentisate oxidase is defective in the alkaptonuria. Because of this defect, this homogentisate on standing or on exposure to air is converted into the black pigment. On alkalinization, it is converted into black pigment. So on polymerization, it is converted into, by the polyphenol oxidase, it is converted into benzoquinone acetate. By polyphenol oxidase, it is converted into benzoquinone acetate, and these quinone forms, they are converted into alkaptone, and this alkaptone, it is deposited in various tissues, tendon, cartilage, nose cartilage, ear cartilage, sclera. It is deposited. Alkaptone in the various tissue causes the black discoloration. That is known as ochronosis. In the intervertebral disc and the joint, it causes the arthritis. Okay, so homogentisate, it is converted into dark colored pigment, which gives the urine dark color, black color urine. On alkalinization or oxidation of this homogentisate acid, it turns dark. So black urine in infancy is diagnostic for alkaptonuria, which is defect in homogentisate oxidase. Phenylketonuria, there is mousy odor of urine, no color. Mousy odor of the urine because of phenyl acetate and phenylacetylglutamine. In maple syrup urine disease, there is maple syrup, smell like maple syrup. Okay, burnt sugar. And homocystinuria, no classical color of the urine, but it is a important disorder in which there is subluxation of lens occur. Then elevated homocysteine level causes serious malformation, serious manifestations, and there is mental retardation, homocystinuria, accumulation of homocysteine, and there is increase in the methionine level also, homocystinuria. Okay, so these are the disorders. Then fourth question, a young child presented with history of rashes. See, these questions, history of rashes. These questions are integrated questions. Rashes, dermatitis means skin. Okay, small child means pediatric. Dementia means psychiatric manifestation. So, young child presented with history of rashes around eyes, mouth. Mother also complains of impaired night vision. Think about, whenever there is nyctalopia or impaired night vision, it diverts you for the vitamin A. Okay, in patient, and complains that the child fall down last month, and the wound healing is not proper. Which of the following is deficient? So there is no vitamin A here. Okay, rashes around the eyes, mouth. So think about the copper. Copper, it is related with the Menkes disease, it is related with the Wilson's disease, it is related with the anemia, and it is related with cardiac manifestations or the blood vessels, large blood vessels involvement because of lysyl oxidase. So copper is not option here. Means copper is not correct here. So zinc. Zinc is the correct answer. Because zinc is required for the maintaining the level of vitamin A in the serum. So what is the function of zinc? It is important for maintaining the levels. Maintain vitamin A level in serum. This is the feature of zinc. Then zinc deficiency of zinc causes the disease known as acro. Acro means acral part of the body. Dermatitis enteropathica. Acrodermatitis enteropathica. This is a skin disorder characterized by dermatitis involving the mouth, nose, then buttock, and the fingers and toes, acral parts of the body. It involves the acral parts of distal parts of the body. That is known as acrodermatitis enteropathica, particularly involving the eyes, mouth, and it maintains the vitamin A level. So it is important. And it is important for the wound healing also. Deficiency of zinc causes the poor wound healing. So here answer is zinc. Then selenium, it is related with it is antioxidant mineral related with glutathione peroxidase. Then cobalt, there are no deficiency manifestations of cobalt. Okay, here answer is zinc. Zinc is associated with more than 300 enzymes. Two important enzymes are superoxide dismutase and carbonic anhydrase. Other are also there, the lactate dehydrogenase, alcohol dehydrogenase, then RNA polymerase. These are the important enzymes in which zinc is a prosthetic group. Okay, they are known as zinc containing enzymes. It is a cofactor in more than 300 enzymes. So it is important antioxidant vitamin, important for the spermatogenesis, important for the maintaining the vitamin A level, important for the wound healing, and deficiency causes acrodermatitis enteropathica. So the top rated question again, the Gaucher's disease. So this is crumpled tissue paper appearance. 4 images was given in the paper, 4 images. Here we only kept one. Okay, 18-year-old presented with anemia. 18-year-old presented with anemia. Wait. Anemia, hepatosplenomegaly. Hepatosplenomegaly anemia. On histopathological examination of bone marrow, the below finding was noted. The most likely defect. This is a crumpled tissue paper appearance. It is PYQ. Previous year question. Okay. Crumpled tissue paper appearance. Crumpled tissue paper appearance. Because the macrophages are loaded with the lipids. It is loaded with the lipids, crumpled tissue paper appearance. So in Gaucher's disease, this is a typical picture of Gaucher's disease and Gaucher's cell. So in Gaucher's disease, it involves here answer is glucocerebrosidase, which is deficient in Gaucher's disease. Glucocerebrosidase. It is also known as glucosylceramide. Glucosylceramide. What do you mean by glucocerebroside? There is accumulation of glucocerebroside in the lysosomes and deposit that causes the crumpled tissue paper appearance in the microscopy. Okay, so what do you mean by glucocerebroside? And for the degradation, glucocerebrosidase is needed. Okay, glucocerebroside means glucose. It means glucose plus ceramide. Glucose plus ceramide means glucose plus fatty acid plus sphingosine. So it is a glycolipid. Glucose plus fatty acid plus sphingosine. Glucosyl ceramide accumulates in the lysosomes. It belongs to lysosomal storage disorder. Due to deficiency of glucocerebrosidase, these glucocerebrosides are not broken down and it get accumulated in the disease known as Gaucher's disease. It particularly Gaucher's disease involve bone marrow, liver, and spleen. bone marrow, liver, and spleen. It involves the bone marrow, so it decreases, it causes the anemia, it causes the thrombocytopenia, it causes pancytopenia, it causes pancytopenia, it causes avascular necrosis of hip joint, avascular necrosis of hip joint, and it gives particular deformity in the X-ray. So suppose this is X-ray of the femur. So suppose this is X-ray of the femur. It will show the Erlenmeyer deformity. It will show. So this picture is like this. So it will show the Erlenmeyer flask deformity. See, this is a Erlenmeyer flask deformity on X-ray in the long bones, particularly the femur, on the X-ray, a vascular necrosis of the hip joint. It involves the liver and spleen, so it causes hepatosplenomegaly. Now the lipid storage disorder or lysosomal storage disorder, there is cherry red spot, but there is no cherry red spot in the K, G, and F. Krabbe's disease, Gaucher's disease, and Fabry's disease. There is no cherry red spot in this disorder. Okay, Gaucher's disease. Gaucher is a bro. Remember the mnemonic, Gaucher is a bro. It is due to defect in the glucose cerebrosidase. There is accumulation of glucose cerebrosides. Okay, and the a microscopy gives the crumpled tissue paper appearance. Now the hexaminidase A, this is the defect in Tay-Sachs disease. This is GM2 gangliosidosis. Tay-Sachs disease is a GM2 gangliosidosis, and there is no hepatosplenomegaly in Tay-Sachs disease. No organ involvement is there in Tay-Sachs disease, and there is cherry red spot in the Tay-Sachs disease. Sphingomyelinase deficiency, it is the Niemann-Pick disease. Sphingomyelinase deficiency is the Niemann-Pick disease. There is cherry red spot on the macula and the hepatosplenomegaly. Now see, a 3-year-old child presented with difficulty in the vision. Wait. A 3-year-old child presented with difficulty in the vision. On fundus examination, cherry red spot were seen. Cherry red spot. Okay. There is cherry red spot in the all glycogen storage disorder except KGF. Okay. There was no organomegaly. This is a typical feature. We already discussed this. Your most likely diagnosis is. So here answer is. So on fundus examination, cherry red spot. So in K, G, and F, there is no cherry red spot. No cherry red spot. So exclude Gaucher. So then Krabbe's is not here and Fabry's disease is not here. So Gaucher is excluded. Okay. Now there is no organomegaly. No organomegaly in Tay-Sachs disease. Tay-Sachs disease, there is no organomegaly. So answer here is Tay-Sachs disease. Now think about the other option. In Niemann-Pick disease, which is due to deficiency of sphingomyelinase, there is cherry red spot on the macula, but hepatosplenomegaly is the classical feature of this Niemann-Pick disease, hepatosplenomegaly. Hurler syndrome, it is not lysosomal storage disorder, it is mucopolysaccharidosis. And in Hurler syndrome, there is involvement of cornea in the form of corneal clouding. Okay, so here answer is Tay-Sachs disease. See, these are the different disorders. Gaucher disease is the most common disease, characterized by Erlenmeyer flask deformity on the X-ray and the crumpled tissue paper appearance on the microscopy. It is due to the deficiency of beta glucosidase or glucocerebrosidase. The accumulated product is glucocerebroside. Then Niemann-Pick disease, sphingomyelinase deficiency, sphingomyelin accumulates. Here the mental retardation, hepatosplenomegaly, and cherry red spot on macula. Cherry red spot on macula. Okay. Then Krabbe's disease. Fabry's disease, it is a X-linked, typically affect the male, and it is Fabry's disease, there is skin lesions, skin eruptions in the form of angiokeratomas. Okay. Tay-Sachs disease, there is no organomegaly, it is GM2 gangliosidosis, there is no organomegaly. It is due to defect in the hexosaminidase A. It is due to defect in hexosaminidase A. But there is organomegaly in the Sandow disease. Remember this. In Sandow disease, along with the features of Tay-Sachs disease, what are the features of Tay-Sachs disease? Progressive neurological involvement in the Tay-Sachs disease, progressive neurological involvement, and cherry red spot on the macula. Along with this feature, there is organomegaly in the Sandow's disease. Okay, so these are the important disorders, lysosomal storage disorder. Which of the below is the biochemical basis of gum bleeding in the scurvy? So C, impaired collagen synthesis, as correct. This is the correct option. Increased keratinization of epithelium. This is in the vitamin A deficiency. That's why Bitot spot and rhinoderma is there, because of increased keratinization. Impaired functioning of clotting factor, it is in the vitamin K deficiency. Because 2, 7, 19, they are activated by the vitamin K. Low calcium level, it is not related with this. Low calcium level causes the tetany. It causes tetany. So impaired collagen synthesis. The vitamin C, it is required. Gum bleeding in scurvy means vitamin C is deficient. Vitamin C is required for hydroxylation of proline. It's converted into hydroxyproline, and lysine, it is converted into hydroxylysine. This is with the help of prolyl hydroxylase. This is lysyl hydroxylase, and this requires vitamin C. Vitamin C. The collagen synthesis, it is a glycine XY. Every third amino acid is glycine, and this X is proline, and this Y is hydroxyproline most of the time, and followed by the proline and hydroxyproline. Next common amino acid is lysine. Next common amino acid is lysine. So it is important for collagen synthesis. It is particularly important for collagen synthesis. Defective collagen synthesis gives the capillary fragility. It causes the capillary fragility, fragile blood vessels, fragile capillaries. So gum bleeding, it is because of fragile blood vessels in the gums. Okay, it is because of improper synthesis of gums that causes the bleeding, gum bleeding. So impaired collagen synthesis. 8th number question. A 7-year-old child came to OPD with complaint of easy fatigability. The mother also complained that the kid is active after meal and extremely hungry and tired in between the meals. Okay, liver biopsy shows no glycogen, means they are expecting the glycogen storage disorder, but liver biopsy shows no glycogen. Okay, what is most likely enzyme deficient in the child? So here answer, what is answer? Here glycogen synthase is the answer. Now think, these are glycogen storage disorder. The branching enzyme, it is Anderson disease, ABCD, Anderson's disease. Okay, debranching enzyme, it is Cory's disease, also known as limited dextrinosis or Forbes disease. Glucose 6-phosphate, it is von Gog's disease. Von Gog's disease. Okay, So these are the features, these are the simple features, means fasting hypoglycemia, easy fatigability and fasting hypoglycemia. So it is a glycogen synthase deficiency, means there is no synthesis of glycogen. So it is type 0 glycogen storage disorder, defective glycogen synthase. There is no hepatomegaly in this disease. No hepatomegaly in this disease. See, in branching enzyme deficiency, means Anderson disease, hepatomegaly is there, and the transaminase levels increases. In Cory's disease, debranching enzyme, the Cory's disease, there is branched accumulation of branch glycogen or limit dextrin in the tissues. And Cory's disease, there is also progressive liver cirrhosis and transaminase level increases. In von Gerg's disease, apart from the fasting hypoglycemia, there is hyperlipidemia, means lipid increases, uric acid increases, hyperuricemia, lipid increases, lactic acidosis is there. Lactic acidosis is there in the von Gerg's disorder. And there is hepatomegaly, no splenomegaly, no muscle involvement in the von Gerg's disease. So left option is glycogen synthase, that is type 0 glycogen storage disorder is the answer here. Next question. A 7-year-old child came with complaints of excessive fatigue and muscle. See, here is the muscle involvement. Muscle pain after playing, means after exercise, muscle pain is there. Blood investigation were done immediately after the exercise, and the result shows low glucose. Immediately after exercise, blood investigations are done. Low glucose and low lactate level. What is the most probable diagnosis? Now think about the muscle glycogen storage disorder. Here answer should be McArdle's disease. This should be answer. So muscle involvement is there in glycogen storage disorder. Glycogen storage disorder, muscle is involved. First is the Pompe's. See the age, 7 year. In Pompe's, life expectancy is 2 years. And there is involvement of heart. So cardiac involvement, cardiomyopathy will causes the death. Okay. So Pompe's disease, the first. Second one is the McArdle's disease. Third one is the Thyroid disease. In these 3 diseases, there is involvement of muscle. In von Gerg disease, no muscle involvement, no splenomegaly, no muscle involvement because glucose 6 phosphatase enzyme is absent in the muscle, and no splenomegaly. Cory's disease, it is liver involvement is there, progressive liver cirrhosis will be there, and elevated transaminase level will be there. So liver involvement, then transaminase level increases, in the Cory's disease. Pompe's disease, heart involvement is there, and the life expectancy is less than 2 years. It involves the Pompe's disease involved the muscle, but life expectancy is low, and it is the severe form. Pompe's disease. McArdle disease, the features are exercise intolerance. The features are exercise intolerance. Then second wind phenomenon. What is second wind? Means if you take a pause after the initial exercise, you can resume your activity. So second wind phenomena is there, and there is passage of burgundy color urine because of rhabdomyolysis. Passage of brown urine, brown or burgundy color urine. So this is the features of McArdle disease due to the defective enzyme muscle glycogen phosphorylase. So this is the feature. See, the answer is McArdle disease. So if thyroid is in the option, thyroid is it is associated with mild hemolysis or mild hemolytic anemia. Okay. So these are the disorders. See, type 0, glycogen synthase defect, no hepatomegaly, hypoglycemia in between the meal, means fasting hypoglycemia. So this is type 0 glycogen storage disorder. Type 1 von Gog's disease. Type 1A is the von Gog's disease. Type 1B, there is defect in glucose transporter, glucose 6-phosphate transporter defect. It is present with neutropenia and bacterial infection. So von Gog's disease, there is hypoglycemia, hyperlipidemia, hyperuricemia, lactic acidosis, and hepatomegaly. There is no muscle involvement, no splenomegaly. Pompe's disease involves mainly the heart, and death at the early age occur. It also involves the muscles. Type 3 Cory's and Anderson disease, there is increased liver enzymes, progressive liver cirrhosis will be there. So in the Cory's disease, the CD and AB, Anderson disease branching enzyme, Cory's disease debranching enzyme. McArdle disease, exercise intolerance, accumulation of glycogen in the muscle. And the Her's disease, this is liver phosphorylase defect, hepatomegaly, and fasting hypoglycemia. These are the glycogen storage disorders. The diagnosis is bowing of the leg. The diagnosis is, what is your diagnosis? Rickets. In scurvy, there is no bowing of the leg. In scurvy, pseudo-paralysis occur because of joint effusion, and it can causes the pseudo-paralysis because of joint effusion, swelling of the joint. Okay, that is in the extreme stages of the scurvy. Okay, but this is a typical bowing of leg on weight-bearing joint. Weight-bearing joint bowing occur because of defective mineralization due to defect in the vitamin D. So calcium deposits or calcium mineralization does not occurs, and it causes the bowing of the leg. Widening of the wrist, when the child start crawling, the widening of the wrist occurs. Okay, so rickets. Genu varum deformity is there. Genu valgum, gum means stick together, varum means away. Okay, so scurvy, it is the bleeding gums, phrinoderma on the posterior aspect of the arm due to the defect in vitamin A or vitamin A and the essential fatty acid deficiency. Pellagra is the niacin deficiency, diarrhea, dementia, dermatitis. 25-year-old person came with complaints of fatigue and tingling sensation in the lower limb. Okay, on examination, his position and vibration sense were reduced. Position and vibration sensed were reduced. So this is particularly the medicine part. His attending physician diagnosed subacute combined degeneration of spinal cord. Subacute combined degeneration of spinal cord. Which of the following responsible for the same? Subacute combined degeneration of spinal cord, it is due to vitamin B12 deficiency. Vitamin B12 deficiency, subacute combined degeneration of spinal cord. Why vitamin B12 deficiency causes these symptoms? Because vitamin B12, it catalyzes the two important reactions. One is the methionine synthase reaction. Methionine synthase reaction, this is the first reaction which is responsible for the folate deficiency also, and it is related with the megaloblastic anemia. And second one is it causes the conversion of methyl malonyl coenzyme A into succinyl coenzyme A. So methyl malonyl coenzyme A, if there is block here, methyl malonyl CoA mutase reaction, if it is blocked here, it causes the increased amount of methyl malonic acid, and it competes with the fatty acid synthesis. Inhibit the fatty acid synthesis. It inhibit the myelination process. Also, along with the inhibition of myelination process, it causes the defect in myelination. Because this methyl malonic acid damages the myelin. So this feature causes the subacute combined degeneration of spinal cord. And this feature, methionine synthase deficiency, ultimately causes the folic acid deficiency. It is responsible for nucleotide synthesis, which is linked with the megaloblastic anemia. This is linked with the megaloblastic anemia. So vitamin C deficiency which causes the scurvy, iodine deficiency will causes the goiter, and vitamin B1 deficiency will causes the beriberi, wet beriberi, dry beriberi, and the infantile beriberi, and also important in the Wernicke's encephalopathy and Korsakoff psychosis. But here the symptom is clear, that is some subacute combined degeneration of spinal cord, so it is related with vitamin B12. In patient with low insulin and glucagon ratio, which of the following enzyme will be stimulated? Which of the following enzyme will be stimulated? So answer is hormone sensitive lipase. It is stimulated by the hormone sensitive lipase. It is stimulated by the increase in the glucagon. So here low insulin glucagon ratio means low insulin and high glucagon. Glucagon causes the phosphorylation. It favors the phosphorylation. Okay, so hormone sensitive lipase, it is an enzyme which is active in the phosphorylated state. Remember, these are the enzymes, specifically the HMG-CoA reductase and glycogen synthase. They are active in the dephosphorylated state, which is favored by the insulin. This lipoprotein lipase, it is particularly important in lysis of triacylglycerol, which is present in the lipoprotein. So here answer is hormone sensitive lipase, which is activated in the phosphorylated state. Activation is done with the help of glucagon. Due to excess drought and crop failure, this MCQ is related with forensic. This MCQ is related with community medicine. Okay, excess drought and crop failure, and entire village people switch to new staple food. So present village people switch to new staple food. Many of the presented to the OPD now with features of paresis, paraparesis, gait instability, and neurological signs. Paraparesis, gait instability, and neurological sign. Which of the following is the cause for the same? So this new staple food, it is Lathyrus sativus. It is known as lakh dal. Some part it is known as kesari dal, lakh dal, kesari dal. Okay, so it is a wild variety as compared to the other crop. It is wild variety. It grows very well in the adverse condition. So lakh dal or Lathyrus sativus, it contains the toxin beta oxalyl aminoalanine. Beta oxalyl aminoalanine. It is a neurotoxin. When we eat Lathyrus sativus as a staple food for a prolonged period of time, it causes the neurological sign and symptoms in the form of paraparesis, gait instability, and neurological. It is a neurotoxin, beta oxalyl aminoalanine. It inhibits the glutamate. Inhibition of glutamate it causes. Okay, beta oxalyl aminoalanine. So aflatoxin, it is the fungal toxin, specifically grown on the peanuts. Okay, and so forensic people can comment on this. The strychnine and ergotoxin, these are also the neurotoxin, but these are not present in the Lathyrus sativus or any crop. Okay. A chronic alcoholic was brought to the hospital with symptoms of confusion, ataxia, and sixth nerve palsy. Ophthalmoplegia. Sixth nerve palsy means ophthalmoplegia. So confusion, ataxia, ophthalmoplegia. See, the thiamine deficiency in chronic alcoholic, what happens? Thiamine is not converted into thiamine pyrophosphate. There is defective conversion of thiamine to thiamine pyrophosphate, and defect in the absorption of this. Absorption defect also. So there is decreased level of thymine pyrophosphate. Here answer is Wernicke's encephalopathy. Now we'll discuss. So there is decreased level of thymine pyrophosphate. This thymine pyrophosphate, it is important in the Krebs cycle. It is important for pyruvate dehydrogenase complex. It is important for alpha ketoglutarate dehydrogenase complex. So defective TPP lead to the decreased ATP production, and also it affect the nerve conduction. Nerve conduction. Thymine pyrophosphate, it is important for the phosphorylation of chloride channels and activation of chloride channels in the nerves. So it is important in the nerve conduction. So that's why defect in thymine pyrophosphate causes the neurological manifestations in the form of the mnemonic is C. CoVA MP. This is Wernicke's. This is Korsakoff. Wernicke's. This is Korsakoff. Korsakoff psychosis. This is psychosis. That is psychosis, memory loss, and psychosis. You've seen the Ghazni movie, memory loss and psychosis is also there. So it is not because of thiamine deficiency. So memory loss and psychosis. So Wernicke's global confusion, ophthalmoplegia and ataxia. So these are the classical symptoms of Wernicke's Korsakoff syndrome. Here Wernicke's encephalopathy. See the symptoms in the case. Confusion, symptoms of confusion, ataxia, and sixth nerve palsy. Sixth nerve palsy means ophthalmoplegia. Okay. So it is in the chronic alcoholic. This is the important hint. So here answer is Wernicke's encephalopathy. So this option. So delirium tremens. It will be commented by the psychiatry faculty, Dr. Dharmendra sir, and the D option was not recollected. Okay. See the respiratory distress. I miss. This is also I have doubt in this question whether it was in this format or some other format. So respiratory distress syndrome caused by deficiency of lecithin, dipalmitoyl lecithin, which lines the alveoli, act as a surfactant, prevent the collapse of the lung at the end of expiration. So defect in lecithin causes the respiratory distress syndrome, and lecithin sphingomyelin ratio is done. If it is more than 2, it indicates the fetal lung maturity. If it is more than 2, it indicates the fetal lung maturity. If it is the sphingomyelin, it is synthesized early in the life, but lecithin, it is synthesized after 34th week of gestation. So it is important, and it denotes lecithin, it denotes the fetal lung maturity. Okay, so lecithin, that is dipalmitoyl lecithin, means the another name is phosphatidylcholine. It is another name for the lecithin. Here dipalmitoyl lecithin or diphosphatidylcholine acts as a surfactant, line the alveoli, prevent the collapse of the lung, and at the end of expiration protect the lung from the collapse. If it is deficient, it causes the respiratory distress syndrome. Okay. The family consuming predominantly polished rice. So there were a lot of questions on the thymine also. Okay, so that's why initially I said that the paper setter was in the drunken state and taking the multivitamin pills. So don't make this statement viral. Okay, because in the next year he will see all of us. Okay, the family consuming predominantly polished rice as a staple diet. Polished rice. Which vitamin is deficient? Polished rice. So I am confused with the options here, but the thymine is the correct option. So this is not the option twice. Okay. Thymine is the correct option because 80% of the thymine activity, it is present in outer alluron layer of whole grains is present in outer alluron layer of whole grain. Polishing removes the thymine. 80% of the thymine polishing removes the 80% of the thymine, causes the deficiency. So it is the sources are cereals, pulses. These are the important sources for the thymine. If we do the polishing, mainly the rice, polished rice consumption as a staple diet causes the thymine deficiency, that is beriberi. Okay. A patient presented with pleural effusion, bilateral crepitation were felt in the lungs. The diagnosis of congestive high output cardiac failure. This is again a very, very important PYQ. High output cardiac failure was made. Which vitamin is deficient? Vitamin C causes the scurvy. So it is not the option. Vitamin B2, ariboflavinosis. Ariboflavinosis means angular stomatitis, cheilosis, glossitis. These are the features. Vitamin B6, neurological symptoms. So option A is the correct option. Thymine deficiency causes wet beriberi. These are the features of wet beriberi. So accumulation of fluids in the pleural cavity, pericardial cavity, in the abdominal cavity, then edema was there, high output cardiac failure was there, increase in the blood pressure was there. These are the features of wet beriberi. It is due to deficiency of thymine, B1, vitamin B1. And I have doubt on this question, whether this was present or not present, or in combination with some other subject. Okay. So gamma carboxylation is required for activation of clotting factor. The answer is 2, 7, 9, 10. So these are the MCQs from the PG paper, the PG entrance examination paper. It was integrated, average paper, integrated with other subject, and more focus or emphasis was given on the clinical aspect of the topic. So thank you.